I'm Kate Hardy and I'm an Associate Professor in the School of Work and Employment at the Business School. My research looks at two main areas, partly about the sex industry and women's working conditions in the sex industry, but also about social movements and particularly around women and housing. So myself and my co-researcher from the University of Manchester were involved in a campaign in London, and this campaign was working with a group of women who had been evicted from a homeless hostel in Newham in East London. What this group of women had done was to try and resist the eviction that they were facing from the hostel that they lived in, but also they'd been told that they wouldn't be given any housing in London and would be sent to somewhere like Birmingham or Hastings or Manchester. So what they tried to do, they tried petitioning and the council to get housing, and then they started a street stall that they did every week in Newham. And what we started to realise is that each week they were collecting data essentially. So people were telling them about their housing conditions and about the type of help they'd asked for and the type of response they'd got. But what we realised is that we were researchers and had the kind of tools to collect this data that they were kind of collecting naturally through engaging with people. So we talked to them and developed this project, and we used a method called action research. And what that means is that you engage directly with the people that this research is impacting on. They develop the research questions and they work with you to actually undertake the research itself. So the findings were actually really shocking. In total, the researchers, so it was the homeless women themselves and people involved in the campaign that actually collected the data. They collected 65 structured interviews, which is a lot of data. And as I said, the findings were really quite shocking. So we were finding that lots and lots of people who were approaching the council for help actually weren't being given any. And very frequently they were being told that they couldn't be housed in London. And this disproportionately affected women, and particularly women and children, and it also really affected people with disabilities. Some of those things we'd kind of picked up already through the street stall, but one that we hadn't really predicted was that there were extraordinarily high rates of poor mental health amongst people who were facing these sort of conditions. So that was a finding that we weren't expecting and that actually was quite shocking. And people were reporting high levels of anxiety, depression, but also quite worryingly high levels of suicidal thoughts as well. So dissemination and public engagement have been a really important part of the project. Right from the beginning actually, by using action research, it's meant engaging people right from the beginning, from the public and from the campaign. So the first thing we did was had a report launch, and we had the researchers, the homeless women, talking themselves at the event. And one of the interesting things we did, I think, was we made profiles of respondents. So we gave them to an illustrator, and we asked the illustrator to draw some drawings to represent the people who had been interviewed. And this was to humanise them and to show that they were kind of people with lives and personalities while they could remain anonymous. And one thing that's been really good is that these drawings are now part of a permanent exhibition in something called the Museum of Homelessness. And that's a permanent exhibition that is touring around different places. There was an event recently in the Tate, London, and there's going to be another one in the Tate, Liverpool. So through this, the drawings and the research are getting a lot of reach through talking to people through this kind of visual representation. Another thing that we did was taking this finding about mental health. We thought that this is something that really needs to be engaged with, and we've developed a network of people working on both housing and mental health issues. So this has included a lot of practicing psychologists who are now working together to think about what can be done about this problem between housing and mental health. Then the final thing that we've done in terms of public engagement is to do workshops with activists who are working on these issues. So we did some in London, we're also doing one in Manchester, and the reason for this is try and develop the tools to be something that could be used by lots of different people beyond the life of the project to try and do something about the housing crisis.